as you are aware, high blood pressure or hypertension is one of the most common ailments which is seen in senior population or old aged people. And therefore, we are going to learn about a very important molecule, a drug molecule which is used in the management of hypertension, that is amlodipine. So what is amlodipine? How is it used? Why it is used, etc., etc. So amlodipine belongs to a pharmacological category, a group of medicines called calcium channel antagonists or calcium channel blockers. Now, how is it used? Where is it used? Amlodipine is used to treat three major conditions. One is high blood pressure, that is hypertension. Second is chest pain, which occurs because of narrowing of the blood vessels, the arterial blood vessels to the heart muscles. This is called as angina pectoris. Or a little rarer variety of chest pain, which is caused by the cramping or narrowing of the blood vessels of the heart, arteries, of course, which is, this condition is called as Prince-Mettels angina or variant angina. If you suffer from high blood pressure, what happens is amlodipine works by relaxing the muscles of the blood vessels, and therefore the blood can flow through more easily. If you suffer from angina, which I told just now, amlodipine works by improving the blood supply to the heart muscle, which then receives more oxygen, and as a result, the chest pain is prevented or relieved or decreased. Amlodipine, please remember, it does not provide any immediate relief of chest pain due to angina. So it is for the long-term management of the angina. What you need to know before you take amlodipine tablets. Please do not take amlodipine tablets if you are allergic or hypersensitive to amlodipine or any other inactive drugs or inactive ingredients of the tablets, or to any other calcium antagonists which I referred to earlier. Especially there are certain drugs called felodipine which come in the same category. Felodipine, nifedipine, nimodipine, etc., etc. Now, what are the manifestations of this allergy? It can cause itching, reddening of the skin, and difficulty in breathing. Then, if you are suffering from cardiogenic shock. Now, what is cardiogenic shock? It's a condition where the heart is unable to pump sufficient blood to the various corners of the body. The symptoms of or the features of cardiogenic shock are low blood pressure, low pulse, and a fast heartbeat. There's another condition which you need to know, that is, if you are suffering from the narrowing of aortic heart valve, this is called as aortic stenosis, or if you are suffering from heart failure after a heart attack, or if you are suffering from chest pain even at rest or with minimal effort. This is called as unstable angina pectoris. So with all these conditions, you need to know before you take amlodipine tablets. What are the warnings and precautions which we need to keep in mind before taking amlodipine tablets? You have to tell the doctor if you have heart failure or if you have suffered from heart attack in the last maybe past 4 to 6 weeks. If you have a very severe and sudden increase in blood pressure, this condition is called as hypertensive crisis in medical terminology. Or if you are having liver problems, if you are very elderly, in these conditions, of course, your doctor will monitor you very closely before giving you amlodipine. Which are the other medicines and other drugs which can interact with amlodipine, and therefore they can have a sort of different effect on the efficiency of each other. So please tell your doctor if you are taking or if you have recently taken any other medicines. Particularly, I'll give you some of the commonly used medications. That is, medications which are used for lowering of the blood pressures or used in heart diseases. For example, verapamil, diltiazem. Well, amlodipine may lower your blood pressure even more if you are taking these tablets along with these, that is the combination of the two tablets. Then certain antifungal medicines which are used to treat fungal infections, for example, ketoconazole or itraconazole. Certain antiviral medications which are used to treat HIV and AIDS, like ritonavir, indanavir, nelfinavir, etc., etc. Few antibiotics like clarithromycin, erythromycin, telithromycin, rifampicin, etc., etc. Then certain antidepressants, for example, nifazodone. Then a particular corticosteroid which is used to treat inflammation and certain autoimmune diseases, that is dexamethasone, which is many of the times used in rheumatoid arthritis. Another drug called dantrolene, which is given in IV form for severe body temperature abnormalities. Tacrolimus, which is used to treat or which is used to modify your immunity. Then cholesterol lowering medication, particularly simvastatin, certain immunosuppressants like cyclosporin, or drugs which are used for management of epilepsy, that is fits. And commonly these drugs are phenobarbital, phenytoin, and carbamazepine. Medicines for impotence, that is sildenafil. So all these drugs, if you are already taking, please remember that you should inform the doctor, and they may have a drug interaction in between them. Now, what about taking amlodipine tablets with food or drink? Amlodipine tablets should be swallowed, not crushed, not chewed, okay, with a glass of liquid, for example, a glass of water, with or without food. It doesn't make a difference. But remember, grapefruit or grapefruit juice should not be consumed by people who are taking amlodipine tablets. Why? Because grapefruit and grapefruit juice can lead to an increase in the blood levels of the active ingredient, that is amlodipine, and therefore this can lead to a very unpredictable increase in the blood pressure lowering action of amlodipine. What about driving and using machines when you are taking amlodipine tablets? Well, amlodipine tablets may affect your ability to drive or use machines. If the tablets, that is amlodipine, make you feel sick, dizzy, or tired, or they give rise to headache, please do not drive or please do not use any machinery. Contact your doctor immediately. Such side effects are likely to occur generally at the start of the treatment or following an increasing dose. If you suffer from these effects, you should not drive or any mechanical activities that require you to be alert. How to take amlodipine tablets? Well, always take amlodipine tablets exactly as your doctor has told you. The usual starting dose for adults is 5 milligrams once daily. Occasionally, it can be reduced to 2.5 milligrams once daily. But if necessary, your doctor may increase the dose to 10 milligrams once daily. How about elderly patients? There are no special dosages recommended for elderly, but care must be taken when the dose is increased. If you have even kidney disease, generally, the normal dose is usually recommended under doctor's observation. You have to keep in mind that amlodipine cannot be removed from the blood by dialysis, and therefore it should be given very cautiously to patients undergoing dialysis. If you have liver problems, please talk to your doctor. Your doctor will then decide whether the medicine, that is amlodipine, is suitable for you, and the correct dose, whatever is being recommended, is going to work in your case. If you take amlodipine tablets more than you should accidentally, what will happen? Well, that's a very serious condition. So contact your hospital. What happens if you take more amlodipine tablets than you should? Well, it's a relatively emergent condition, a serious condition, and therefore you should contact your doctor at the nearest hospital casualty department. Please also carry with you the product leaflet or the remaining number of tablets for better identification by the treating doctor. You should lie down with your arms and legs up. resting on a couple of cushions, for example, so that more amount of blood flow is directed to your upper part of the body. What are the symptoms of an overdose? Extreme dizziness and or feeling very lightheaded, faint or weak. Then one can have problems with breathing. Then one can have a tendency of urinating very often. If the blood pressure drop is severe enough, one can also face a condition, a medical emergency called shock. In these conditions, the skin could be felt cool and clammy, and you sweat very profusely, and you may lose consciousness also. What happens if you forget to take amlodipine tablets? First of all, don't worry. If you forget to take a tablet, leave out that dose completely, no issues. But take your next dose at the right time. Do not take a double dose to make up for the forgotten dose. If you wish to, or if you totally stop and amlodipine tablets, well, as I've said, you should take it regularly. Your doctor will advise you how long to take amlodipine. Remember that your condition may return if you stop to take this medicine before you are advised. If you have any further questions regarding continuation of the treatment, you should always ask your doctor or pharmacist.